So you feel that the public health system has failed your mom? Hmm.
Where the camera? Yeah.
Juliana, I understand that you're going blind.
Yes, ma'am.
How long ago did you notice this?
I noticed about a year ago. I could hardly read the fine prints. Fine prints. And when I went to the doctor, a couple months after, the doctor told me that I have to do a surgery. Laser surgery in Kingston.
Laser?
Laser, yes.
In
In
Kingston?
Kingston, yes.
You
told me.
are living in where? Where do you live? Westmoreland?
Yes, Westmoreland, yes.
So you went to the doctor where?
Savlamar.
And the Savannah Lamar Hospital, or is a private
It's
doctor?
a private doctor.
And they said you had to go to Kingston to get it done? There's
Yes.
nothing in Montego Bay?
That's what they told me.
Okay. Where in Kingston were you
Referred
told
to-
to go to?
UE.
University Hospital?
Yes.
So, what time last year was that?
Last year, I think last year, July. But I didn't went until January of this year.
January 2022?
Yes.
Okay. What happened when you went to UE?
I went to UE and I registered and everything and paid the money. And when I paid the money, they said they couldn't do it that day. They give me back a next appointment again. And I went home. And then when the appointment came through in February, I went back again. And when I went back again in February, they said the appointment, what that they gave me, they said I should, where you go again, Chin? Come back again, right, to come back again. The next appointment in March, no?
Mm-hmm.
I think it's March. Look on the appointment card and tell me.
So, why were they sending you back?
I don't know.
The,
They never gave me nothing, miss. They never tell me what they must send me back and forth, so miss. Never tell me.
Like the doctor full up, and they
Yes.
just keep on excuse. And we were up there for 5 months.
5
During
months.
all that time, Mommy had to send him sick leave for work. Because she
Mhm.
didn't only apply for the time to go to the eye. The
Okay.
first date we got was the 11th of January.
and you are the person who took her to the doctor?
Yeah, I've been the person who's taking her to the doctor back and forth. Me have to apply for time from work same way, just as her. So I'm the one who basically she's with at the moment because she can't be by herself in this type of condition. So she's with me. So me have to take the time out to do all of what me I tell her so me know exactly what is taking place. So I also apply for time from work. I'm take her to Kingston in December because at January the 11th.
You're talking about December when? December
of 2021.
Mm-hmm.
I went to Kingston with her. So I went over UA. This was the first day because I had to register her. In order for her to get a docket.
Show us the forms, the receipts, etc.
Alright, this was the registration form.
Turn it around so we can see it.
January the 11th
Right.
of 2022.
Mm-hmm.
So when I went, this was the first day and they gave me the appointment card. We never got through. They said I should come back the 24th, which is 3 weeks time or 2 weeks time.
24th of January?
Yes, it's the same month they said me to come back. I came back on January. When we go back, we still not get through. It's all sort of excuses again as to why she can't see the doctor. It's either it's full at the moment and we have to get a next date or something. Then
Did you pay the hospital any money?
Yes, we paid the money.
How much money you paid?
Alright, at first we paid this is the check she gave me back for 27,000 me paid this at time. And when me do the registration I had to pay $2,000 in order for she go up on the list. And she said me have to pay the money before me come up there for then talk about the laser. Me have to pay the money first. So after me pay the money, that's the time now then start dealing with me about the laser. Anyways, when me go back up now, Then say we have to come back February 22nd. That is 4 more weeks. And when we go back, she still not get through. Then say we have to come back again.
With all of these dates, you're going back and forth.
Yeah.
What condition was your mom in? Her eyes, for instance, was
Getting
she able to
worse.
see?
The type of condition she have. Sometimes it's very blurry, it's dark. She can barely see. And sometimes she can glimpse a bit. As you see, it's okay, you know, she can glimpse. But there are times when she says she can't see so properly, she just barely has the shadows.
Do you know what the condition is?
Yes, they said that she is diabetic. And that's basically what they said. They said it's because she's diabetic and it's a high level. So the situation can get worse. So me ask them, say, if the vision can be repaired. They say it can't be repaired, but they can try to see if they can save what vision she have left. Because of the diabetes I beat her. That's what they said to me, because I've been asking them. So they said the surgery now going to restore the vision 100%, but it will help whatever vision she have left, as in restore that the part of her vision. So that's what they said to me.
Alright, so talk to me back. Go back to February. You
Yes.
went February and you were given another date?
Yes, the 25th of April.
25th April.
Yes, and see the right on it, laser was not done. So you can see I paid for it there. And the card is telling you, say it's not done. Right.
Laser not done.
Not done, right.
Alright.
And then now after this, when we go upon this day, the 25th of April, they had us in a room like with 20 persons. And the 20 of us was in there waiting, same way. And then one of the doctor come out, oh, it's so unfortunate the laser machine has broken down. So me said to the doctor, say, laser machine broken down and we out here for how much hours can me come early so she can get through, and the machine broken down and have me come up here for 5 months.
And you're
now,
leaving from Westmoreland to
from
Kingston?
Westmoreland.
How long the ride is?
4 hours from Westmoreland to Kingston. But luckily I me have my sister. Sometimes we can stay by her.
Right.
Understand? So God make that they happen for me. So me say to the doctor, him said to me, say, all he can do is give me a referral for Cornwall Regional because their laser is not working at the moment. And even after that, they say 6 to 8 weeks before they can start give me back the payment. So I said to them, this is very hectic on us. We take transportation from Westmoreland to come Kingston all the while. And I say, lucky things I have my sister where we can stay by her, but I'm taking time from work and we come up here and know nothing can be done for 5 months. Me dey back and forth with my mother, nothing can be done. And then you now go tell me, say, me have to wait at least 2 months before you can even start giving me back any payments.
So they weren't giving you back the money that you had paid to
No,
them?
not at that time. Not at that time. They said that I have to wait until the 3 weeks, 6 weeks. So you know, say that almost 2 months. After that, now then start give me back something.
Okay, so you went to Cornwall Regional Hospital?
Yes.
And what happened?
Because me not familiar with the routines up there. But anyways, I had left early because me know say them there's something that you have to leave your yard early. So I reach up there some minutes after 9 the first time. And when I reached, I said to the security, I'm leaving from Westmoreland and I got a referral to come and see the doctor. The security said they stopped taking referral for the day and I have to come back. So I said, what you mean it's just after 9? He said, miss, people they here from 5 and 4 o'clock. See what I'm saying? Say, and if you have to reach in time. And me said to mommy, say, we have to come back. So me leave and me say, we are going to go back again, you know. So me said to him. So me say, at least let me talk to somebody. He said, no, they ain't have to take referral and I come with. And I go back up there again with my mother earlier this time. I leave CM 5 o'clock. I'm going to try to reach earlier, but I reach 8:30. But I can't do nothing about the timing because it's so hard to get bus to go to Montego Bay. Them time because you have workers from Freeport and place where I push for the bus. Till one of the time, one of the man we sell handicap man have to give mommy a seat. I said, don't make them push down your mother. You know, because people are rushed to get to work. So I understand. So we were successful. We got a drive. Me reach up there by 8 o'clock. And I said, Mommy, we have to try to see if we can reach because at 8:30 appointment you have. So when we reach like 20 after 8, I almost reach 8:30. And I say, Siki, I have an appointment card. And he said to me, appointment card for what? Me say, to see the eye clinic. He gave me a number and he said me have to wait on the number for call. Anyways, me get 98 and me not hear the number call. Me go to the security and me say, me not hear 98 call and stop take number for the eye clinic. He said me have an appointment card. I gave it to him. And when me give him the appointment card, he asked me, say, what are my mother's date of birth? Me say, our date of birth is the 3rd of May, 68. He say, alright, me feel listen out for your name. I did it for 2 hours, I not hear my mother's name a call. And me go to the security. And I say, I can't hear Juliana Blair a call, I know what the problem. He say, when me hear from, he say, eye clinic and she's supposed to do a laser. And he say, alright, me fi come in. And me come in, you know. And I give them the referral. You know, so the doctor tell me, say, me could have never come there already with the referral and don't get through. Me say, me come and the security turn me back. Say, I reach here too late. The doctor say, me could have the referral from so long and don't get through. Me say, yes, and then give me a different date on the appointment card. Last week, me carry mommy the 7th of December. The appointment card is in the other purse. The 7th of December was the last day. See it here, and allow me to tell you, see it here. And look at it, the 7th of December, that was last week now. Me go back and then said to me, say, this was the appointment card then give me, I said, if I come back. So you see, last week now when me go back, she said, anyways, we are finished for the day, and you can't get through. Because then finished for the day. So last week, the 7th of December, when me go up there, at the same procedure, me go through with the security. And then make me come in and something, and me have to get from compartment to compartment because I can't hear my mother name a call. You see, at the end of the day, it was 1 o'clock and the security said them finish the laser. So me tell him, say, I want to talk to the doctor. And he make me go down there and say, if you talk to the doctor. So I say, how is it that I not hear my mother name call? I'm up here for how long? The doctor said to me, she can't find my mother's docket. So I say, how is it that you can't find my mother's docket? She's supposed to do the laser. And the security said, if she's supposed to do laser, her docket not there over here, say they're over the other side, and then go around there. And same time, my mom said to me, say, the lady said to me, say, the best date she have if she get the laser done is 2 months from now. 2 months from now, you know. 2 months from now is February, you know. The 11th of February. She not even write it on it. 2 months from now, the 11th of February. And she said to me, say, but if it is that I want to pay the money and do it, she knows a Dr. Rodriguez who has an office. She said she don't know her personally, but she know that the doctor have office in Montego Bay, Church Street, something like that. And she gave me the paper for me to with the doctor's address and where to find the doctor. And she had tell me how much me fi pay.
How much is it gonna cost for you to do it privately?
Right, she said she think, no, my sister had called him because the doctor is saying she's not sure about the price. But my sister had called and she said she think it's 50,000 for the one of the item. So she's saying that maybe the 2 eyes them will cost 100. I'm not sure about the price because as me tell you, I Judith me give it because I was so fed up. Me call her and basically I cry at me and say, look how much time back and forth. Imagine you carry somebody go to hospital. So much time for one situation. It's been a year, you know. Because from December until this December, it's been a year.
Yes.
So when January coming, it's a new year. And she haven't gotten no result from no... And then like so she paid the money, she not get through. She tried the government system and she's still not getting through.
In the meantime, your mother worked before this, and
My mother
I
has
understand that she may have lost. She had to retire, had to
Yes.
resign from her job.
Yes,
Yes,
I have to do that.
you see, after the 5 months, when we not see if she get through, we start to apply for early retirement for her because we realize she can't go back to work in a this condition.
What kind of work she did?
She was a security officer with a prominent security force for 28 years.
Mm-hmm.
Is the Gleaner has published her, she always go up at Kingston and go get award and stuff from them. So them know say she do her job. She's a very good worker. She not absent for her work and them someday. So the minute she started sending in sick leave, you know, the people always a call her ask and say, what is wrong with Miss Blair? Is she okay? So me have to tell them say she have to get her eyes sorted out and we haven't gotten through as yet. In which case mommy love her job and she not really want to stop work at right now. Cause she say she's only 54, you know, her retirement age is at 65. So she's saying I can at least work for 5 more years. You understand? I understand that.
Mommy, talk to me. Tell me what is happening to you right now. How has this affected your life?
Bad, miss, me I tell her. Really bad, because I have my bills them to pay, my loan them to pay, and nothing can work.
You are always an independent woman. You have to get help to walk.
Always, ma'am, always.
You have to get help to walk to see what's happening around you.
Yes, I can hardly walk sometimes, because I cannot see where I'm going.
So now that you have realized that you may have to go
And pay again.
privately, not pay again, but go privately because
It's pay again.
none of the systems here is
Aren't,
working for
yeah.
you. None of the public system,
System.
the hospital system is not working for you. And your mom is likely to go blind.
Yes.
So
We
what
have
are
to-
you gonna do?
We have to just find the next way to get her the help that she needs. We have to fly in the next platform and if it's it that we have to find the next 100,000 then to pay, we have to do that. Because I would have rather sacrifice myself for certain things that me have planned towards. I know say my mother alright. You understand me?
So you feel that the public health system has failed your mom?
Where the camera?
Yeah. I mean, who don't want she pick up like so me I try my best to get the help she want. That's why I take time out from work and do everything to make sure that I can help her. I don't reach nowhere in her life yet and my mother work hard to help all of it. And I would like to know that I not make it in her life and she can't even see. She sees that we pass the words. I want she get the help and it be possible. I want she get the help. That's my main goal. I save towards. I do everything to make sure she's alright. We take 2 weeks from work, boss leave at England, and I run the store for her. And I call her, I can't even call her now, I ask her, I call her, I say, Miss Joan, I need some time from work to carry my mother go Kingston. I need some time from work to call my mother go Montego Bay. Even last week, I take the entire week because I tell her, I don't know if it's surgical successful because I had the hopes of me go up there and my mother I go get through. So me never know, so me I go come back and sit down with my mother again through this situation here. So me I try my best if she get the help where she want and if it's a situation where me have to pay the money, me just have to pay the money because me go through the government system and it don't make no sense.
Do you have the money though to pay?
No, ma'am.
Me not have it at the moment but me I save towards it from me find out because I've already spent so much in a traveling expense.
About how much you have spent so far?
To be honest, in everything with me I do, I spend maybe 250 already.
250,000?
Yeah, in everything, traveling expense and everything.
Oh.
You understand? My sister them pitch in and they do what they can do, of course. All the way I try to help good mother because I one mother we have. So all the way I try my best. So when I came back from Montego Bay, I get the paper from the doctor. Because because she's saying I can do it independently, as in me not, if me have the money, me fi do it, because 2 months before I can get back up there fi fill a slot fi get the laser done. So me say to my sister, say me a work, you know. Me call them and me say me a work, you know, and anything when me can put towards it, me a put towards it, because we can't sit down and have mommy go blind like this. We have to just try our best to do what we can do for help her, you understand? So they say they agree. So sister called them and so come she get the price for how much they say to do it and stuff like that. So she's saying that they said if she don't do it by the 21st of this month, she have to wait, because even that doctor in Montego Bay, that private institute, even that private
because
institute
it's Christmas
full
week.
up. And she said if mommy don't come in by the 21st, we get it done.
She's
She can come again till in the next year sometime. And then now she said we have to pay a fee of 6,000 for them see what is really going on. As in everybody have their own system, but they want to see for themselves what is going on with her eyes. So we have to pay that fee first, and then now we have to come back in to get the laser done.
Is there any message you want to send to, for instance, our senior medical officers, the Ministry of Health, Minister
Yes.
of Health, in relation to
Yes,
what
there
your
is.
mom has gone through?
If I'm at a hospital from 8 in the morning or 9 in the morning, it doesn't mean whatever time I'm there. You're telling me that the doctors can't put in enough effort to say the patients are tend to by 1 o'clock when the sun done the laser, and 1 o'clock is not even half day properly, and people are leaving from Westmoreland to come so far so they can get the help that they want. And 1 o'clock when I tell me say, oh, we are finished lasering for the day. This is a health system. When you go to hospital because you want to help a life and death situation, I'm saying they could have at least, you know, make we put in somewhere else. I believe that the minister really need to check upon the hospital them and see what is taking place, because everybody just don't care. It's as if it's not their situation and them a get paid regardless. Whether them put in the hours or they don't put in the hours, their money must come. So them not really care.